Back to COVID news. Doctors are warning about a spike over the summer. While numbers remain relatively low, the CDC is reporting hospitalizations are up 12.1% in the past week. But the number of COVID-related deaths has remained steady at 9%. At 0.9%, rather, not 9.9. Joining us now is Dr. William Schaffner. He is a professor of infectious diseases at Vanderbilt University Medical Center. Okay, Dr. Schaffner, why does it seem as though people aren't concerned about a summer COVID spike?
Lilia, all you have to do is look around. People are out and about. They've kind of put COVID in the rearview mirror. They're traveling, they're visiting their relatives, they're enjoying the summer, getting together. But along with the COVID, we'll see that slight increase in number of cases. We're not going to have a surge, but every summer we have had an increase, then it goes down again, and then we get another increase in the winter. We're much better off than we were even a year ago, and going forward, we're just going to have to learn how to live with this virus. And when the time comes this fall to get the new booster, which is now in the works, we all ought to get that vaccine. That'll help prevent our developing serious disease, the kind that requires hospitalization.
I mean, that's what people do with the flu. You get the flu shot every year. You don't have to deal with it much. Is COVID now finally in the same category as the flu, or is it something people are just coming to accept?
Well, folks are beginning to understand that it will be kind of like the flu. That's what we anticipate, that each year we'll have to reawaken our immune systems, get that booster vaccine along with our influenza vaccine in order to protect ourselves against both of these very serious winter respiratory viruses.
One thing I haven't heard about a whole lot lately is testing, COVID testing. We are also not hearing about boosters, though you did just mention it. Are you concerned that there could be a new outbreak now that so many of us are just putting COVID just in the back of our minds and not being so proactive in terms of testing and boosting?
Oh, sure. We are concerned. And now that we have taken the emergency out of it, and we have now gone back to our usual system of delivering medical care, we're doubly concerned that there are going to be disadvantaged people who don't have access, who don't have as good health insurance as other folks who may not have the direct access to testing, vaccination, and medical care. So we're going to have to be very, very attentive to that going forward.
So we're just weeks away from, weeks or days, can you tell I have no children, from back to school. What should teachers, parents be thinking about?
I think the folks that are at greatest risk of getting serious disease, older people, people who are frail, people who have underlying serious illnesses, people who are pregnant, people who are immunocompromised. Those are the folks who ought to take those special precautions. Get your mask out, wear it if you're traveling, if you're going to indoor group activities. And then when the recommendations come out later in the summer for this new booster, pay attention. I think everyone I've just mentioned is surely to be recommended to receive the vaccine.
Dr. William Schaffner, thank you for that advice.
Thank you.